The distal biceps tendon repair using the biceps button and tension slide technique allows the surgeon to repair the biceps tendon through a single incision. The combination of button anchoring coupled with a screw alongside the tendon creates a strong anatomic repair that may allow for early range of motion. An incision is made over the skin in the area of the distal biceps attachment near the elbow. The biceps tendon is identified and liberated, bringing it slightly out of the incision. The tendon is repaired by removing any weak or degenerative tendon. The end of the tendon is sutured using a baseball stitch technique. The two strands of suture are passed through a metal button in a specific pattern. A guide pin is drilled through the natural attachment of the biceps tendon on the radius. Sliding over the guide pin, a socket is drilled in the radius. The button is then passed through the socket and comes out the opposite end of the tunnel. The suture strands are pulled to dock the tendon in the base of the tunnel. Once the tendon is fully seated, a free needle is used to pass one limb of the suture strands through the tendon and tie a knot. A screw is inserted into the tunnel to help recreate the anatomical footprint and for added strength of the repair. A knot is tied over the screw and the remaining suture limbs are cut. The distal biceps tendon repair is now complete in an anatomical fashion. The ability to bend and extend the elbow as tolerated is permitted as directed by the surgeon with appropriate restrictions. Most patients have full range of motion at the final follow-up with the doctor. After time, return to heavy activities and jobs involving manual labor is a reasonable expectation.